Okay. I'm here with Steve Sparkowitz. I have that right, Steve?
Yes, sir.
And you're the first Sparkowitz I've ever met. And we're videotaping this. Do we have your permission to videotape this?
Absolutely.
Thank you. Tom, you want to give us a little intake on this patient?
He's had 3 surgeries, Steve, or on
three on the L4,
okay.
L5.
L4, L5, S1 joint over a period of 20 years. Last one was just recent. You can see it's not even fully healed yet, or healing right, actually. They keep going because the disc keeps protruding and acting up, and this last time he said they went in and hollowed out L5 to give a little more room around the spinal cord itself. And look at Steve's problem is here. Look at the paraspinals on this side, how flat, placid they are. Look at that. Nice.
So he's got on the left side, he's got a lot of edema, it looks like.
On the right side, look, clear up here, just hard as a rock. Look how swelled up it is. Look at that. It's
on the
terrible. Right, and because when the muscle is spasming like that, it shortens. Look at the scoliosis it's developed. He's over an inch out of line. Look at that.
This muscle is hard as a rock. Oh, my goodness.
It's terrible.
And it's in spasm right now.
Yeah.
That's involuntary contracture, which shortens.
It's
like a string on a bowl, pulling on a bowl.
But it isn't his complaint. His real complaint is down at the end of this spasm, because at L5S1, where to the iliacum there is no movement, this is jerking all of that spine out of place, putting pressure on that joint and keeps knocking the disc out of place. Nobody has done anything to correct the problem.
So, Steve, you mentioned that you have, what are the things you've done to try to resolve this pain in your back?
Many. Standard chiropractics, 3 chiropractors, nothing going there. Spinal decompression, that I think just about paralyzed me.
How many treatments did you have with spinal decompression?
I had 7. And
did they do an MRI before you were treated?
Yes.
And they saw a herniation?
He's probably had quite a few MRIs, haven't you?
Yeah, I've had 2 MRIs this year.
Did they tell you that they thought spinal decompression would resolve their problem?
Yes, 2 different chiropractors.
Different machines? What type of machines?
The VAX-D and then the DRX...
DRX 9000.
9000, both.
So you thought, did either one of them reduce your suffering or pain at all?
No. The one I chose, VAX-D, increased it 5-fold. Made it so I couldn't even work. I had to go in and get a cortisone shot just to walk.
How many treatments did you have on the VAX-D?
I had only 7, but
7.
Every day it got worse.
You were face down for your treatment?
Face down.
Did you hold the handles, or did they put a belt around you?
And face up, both. I started face up, then they flipped me over face down. That's when it got really bad. They strapped me in there. I didn't have any handles.
So then you thought the DRX 9000 will do a better job?
No, I'm scared to death of that technique
now. Well, did you have a treatment on the DRX 9000?
No, I didn't. Some of it's cost because it's, they wanted $4,000 something even to see me for one treatment.
And so, was it before or after you had surgery that you had spinal decompression?
Before.
It was before surgery.
Yeah, I tried many approaches before surgery to avoid another surgery because I know it's, everyone
He did have some relief from TENS unit.
Okay, so you used TENS unit then, and it gave you some relief.
Well, I used a TENS unit in my last surgery 6 years ago after, and it did help.
Has anyone ever talked to you about muscle strength imbalances?
I did do some treatments using the Egoscue method in the book Pain Free. Got some relief, but then for some reason it started getting worse.
Did anyone ever palpate your back like Tom has to show you that one side is in spasm?
No.
No one's ever done that. And this is a profound...
20 years.
Tom, 20 years he's had this problem. What do you think put him in spasm in the first place? Some kind of ergonomic imbalance?
No, he had a skiing accident 20 years ago.
A skiing accident.
And ruptured a disc at L5.
Okay. And so he had...
And that was probably a factual. The others, the muscle spasm has to be a residual from that original injury. Nobody has ever corrected it. And the others now are because this area is already injured and is the terminus of the scoliosis, the bottom of the muscle span, which is gross. I haven't seen one that gross in ages.
What's causing this scoliosis is, first, this muscle is shortened, involuntarily shortened here.
Yes, and
on
it's
the right
pulling
side.
this part of the spine and this part of the
So it's
spine,
like
bending it like a bow.
Yeah, like a tightened string. When
It's
the
a
muscle,
tightened string on a bow.
when the muscle's this hard, it's in contraction, involuntary contraction, which means it's shortening, and that means it's pulling on the bow. In this case, the spine.
Yeah.
Now, that spasm is the muscle's complaining about an imbalance. A muscle
Might be that the left side is too weak, and the right side is having to overcompensate, or it can be that the right side has gone into spasm because of trauma, and has caused this, and keeps the left side from developing.
So if
we
they-
don't know. So other treatments that he'd been trying to do to balance these, we're working both sides, and by working both sides, then you're just raising or lowering the level of the injury. You're making it worse.
So Tom, if before they cut on him, before they did spinal decompression, if someone had properly identified the muscles in spasm, the edema buildup that's clearly on this mushy side over here, that's all mushy.
Yeah.
He's got fluid buildup. Now, if we hook him up with a NeuroCare right now, what do you anticipate we would see with a patient like this?
We're going to balance out the muscles. One treatment's not
But
going
if-
to do
if
it.
you did a
But
diagnostic-
he's going to have.
I'm thinking diagnosis.
From this point, I won't even go into.
You don't need to, but if
the
you hooked
treatment.
up two electrodes, you would see this side contracting.
And this one would be real high on the dial.
No
And,
muscle movement.
and
Because it's
because
all going
of
to
the
the fluid.
edema, probably an awful lot of intensity, but no movement and no pins and needles.
Mm-hmm.
Over here, he's going to have a contraction at a very low level on the dial. We're going to give him a treatment here real quick. I can't let him go out of the office like this.
Not
But
like
we're
this.
going to work the left and right sides independently, bypassing the reflex arc. We're going to do it in such a way that we'll try to get as high of intensity on the weak side as possible, and just enough intensity, lower intensity, on the right side to relax it. So as this relaxes and this gets stronger, we're going to straighten the spine. We're going to take the pressure off.
If they'd done
They'll
this
be
years
wrong.
ago before they cut on him, do you think they could have avoided surgery?
He ruptured a disc 20 years ago. They had to cut on him.
Okay.
But the trauma, all of this, I would bet $1,000 bill, sight unseen, that this happened at the time of the accident. That's what popped him here because of his position or something. And it's never gone away. He's had it for 20 years.
That's a safe bet, by the way. They don't make $1,000 bill anymore.
Oh, okay. So I'll do two
Prior to
500.
surgery 2 weeks ago,
Yeah.
the bow and scoliosis is twice as bad.
Mm-hmm.
Right after surgery, it straightened it out, but now it's coming back.
No,
It's coming- you know why that
Because
is? Because they did nothing.
They cut the muscle that was in spasm.
That's what they did with his surgery?
Yeah.
So they did nothing to resolve the muscles in spasm other than just cutting the muscles that were in spasm.
Therefore, they lengthened back out. Everything came back in. We're going to try to do that now for you.
Okay.
Okay? It won't be painful.
It'd be
Turn
very
around
interesting
for
to
me.
do a little diagnosis, Tom. If you could just show two electrodes, one on each side, and see
I
if...
can do it, but I really have to get on to
Okay.
our appointment. I
Oh, we have-
crowded in here today, and we have to be at.
Oh, we've got to go someplace?
We have to be down at Toledo.
I
and,
gotcha.
2 hours
Just,
away.
just hook them up real quick, both sides, so we can show how one side is full of edema, so all the electricity goes to the fluid, no muscle contractions. The other side in spasm, hard as a rock here, will generally will be
Okay,
contracting.
but he's got to be seated to do it, so I don't know that you're going to. I've got to get these in place first.
Okay. So you're not going to do diagnostics today?
Well, you can see it for
Okay.
coming up on it, but he'll have to be seated, and therefore you're not going to be able to actually see the function. Otherwise, I'm going to throw him on the floor.
You
Okay.
tell me what I need to do, I'll do it.
No.
I'm supposed to jump on an airplane in the morning, and
No.
You're dreading that.
don't know
Don't
that
you
you're
love
gonna
those
do
airplane
it.
seats? How do you like those seats? They're designed for tall guys like you to slump your shoulders forward for 5 hours while you're flying.
my job is to fly to all over the world, and if I don't get this fixed, I don't have my job.
Interesting. Well, you say that with a smile, but it's a very serious subject.
Yeah. Well, it's a,
But you know,
it's a
you're-
grimace. It's not a.
You're not here by accident. How
And
did
a
you
company like Hua Chang, you don't find those jobs every day.
How did you hear about NeuroCare?
A dear friend that I had lunch with yesterday or 2 days ago, right before he came here to visit his friend Tom.
Did he tell you that it worked for him?
His wife said it did. Did you treat her?
Yes, but she still needs quite a few.
Yeah, I would be interested in renting, buying, whatever if this works.
Well,
So
let's
this
see
is
how it works
this
for you.
electrode's going to
Okay, come.
communicate to here, and this is going to communicate
Yeah,
to
we're
here.
doing the left and right side.
Okay.
Come on back and just
Have a seat.
a seat for us.
If you want me to lay on the floor,
No.
I'm not too proud. So.
Let's see if we can. Greg really wants a shot of this. Okay, I'm going to turn this up. You tell me when you can feel.
Lower
a
left
tingling.
and upper right. I mean, yeah, okay. There's a tingle on the left, both of them on the left, and a little
Okay.
on the lower right.
I'm going to come up until we see a muscle spasm or contraction.
Yeah, stronger on the left.
I'm just doing the left. So.
Yeah, that's pretty good, right there.
Okay.
Oh
Now
yeah.
I'm going to turn that off and come over to this side. Okay. Muscle spasm or contractures are equal. We are 45 on the right side. We were 84 on the left side. Takes that much more to make that side.
So with the settings of the machine, the left side where the edema is, you had to turn it up to 84 to get muscle contractions.
to equal what we have on.
To equal what you got in muscle contractions
Yes.
on the right side where the spasm is
And it-
at half the power.
Yeah. It shows us exactly the imbalance that we expect to see.
So you're looking for visible contractions at this point.
Oh yeah.
Well, now that's involuntary. That contraction right there
Yeah.
on the left side. Where
Let's
all
see
the
how
edema-
we're moving.
Now, what do you have that setting on?
Look at what's happening to the spine. I'm doing it.
That's
My goodness, look at how it curves the spine when you're doing that.
Yeah, now I'm going to even them out.
Now even out the other side. Now we got both
Okay,
contractions.
now do those feel equal to you, Steve?
maybe a little stronger on the left, just a tad.
It looks about equal. From a viewpoint, it looks
Yeah,
equal.
the lower right, for some reason, I don't have near.
Let me see what this-
sensation, but maybe it's.
No, that's because of the edema where that bulge is. I'll talk to a metal engineer, but electricity still goes to the least resistance on either branch of engineering,
Got it.
and edema is a better conductor. So,
Edema is what, retention of water?
and that's the bulge is simply a healing white blood cells going there for the surgery area, and you haven't been able to work it out.
Now, so we at first we had a setting of about 85 on this left side to get contractions, and you had only 45 on the right side to get contractions. Now, over time, you'll move out the edema on this left side and relax the muscles in spasm on this right side. Correct,
Yes.
Tom?
Okay, lean back for me. So
Relax.
try to scoot back into the chair. You'll just be flat.
I'm going to go ahead and turn the camera off for just a minute.